Okay, thank you all for joining us today and welcome to TouchCare's Return to Work program presentation, The Right Tools for Reopening. My name is Angela Marshak. I'm the Vice President of Sales here at TouchCare. Before we get started, I just wanted to remind everyone that you can submit any questions at any time during this presentation in the chat feature. You'll see it on the bottom right-hand corner of your screen. We'll be answering questions at the end of the webinar. With that, I'd like to pass it on to Rob LaHayne, our CEO here at TouchCare.
Great. Thank you, Angela, and thank you all for joining us today. Before we get started here, these are obviously complicated times for people. COVID-19 has reshaped the way that we interact with each other as individuals in society, the way that we educate our children, the way that we work, and ultimately the way that we receive and interact with the healthcare system. And sort of focusing on these items, employers face a really particularly daunting challenge as we think about how we can safely welcome employees back to work and back to the workplace. And so for employers who are looking for ways to bring their employees back into the office, they need to be looking for ways to do so in a way that will really emphasize employee health and safety in a way that we've never really considered it necessarily before. And ultimately, it's really our responsibility to create safe protocols that will ultimately really reduce the risk of infection for everyone, while obviously continuing to maintain productivity in an office setting. So today we're excited to be here to talk about strategies that we've created and deployed with some of our employer groups through a program that we've called TouchCare Shield that focuses on helping employers reopen safely, as I mentioned, in a way that emphasizes employees' health, safety, and well-being as sort of the main cog of your reopening strategy. So to jump into it here, brief agenda today, we're going to spend about 30 minutes or so going through the presentation, and then we'll leave some time for Q&A at the end. But as we go through, we're going to explore really the brief, and it seems like an eternity, but the real brief history of COVID-19, take a look at that and sort of where we stand today, and then dig into the return to work strategies for folks who are reopening their doors during the pandemic that we've built and are ultimately deploying with our employer groups who have safely welcomed employees back into the workplace. And then ultimately we'll wrap it up with some Q&A at the end, like I said. So Angela got us kicked off here today. She runs Salesforce here at TouchCare. And quick introduction to myself, I'm Rob LaHayne, the CEO of TouchCare. We are a healthcare concierge services company that works with employers to deliver an improved employee healthcare experience while also focusing on reducing both employer and employee cost. And so excited to talk to you today about TouchCare and about the programs that we've created for our employer partners and clients. And so to take a step back as we get started here today and just take a 30,000-foot overview or 30,000-foot look at what the current landscape is for the state of the pandemic. So most of these stats shouldn't surprise anybody on the presentation as they're sort of constantly in our face through the news cycle. But the bottom line is that we still haven't effectively gotten COVID-19 under control yet in this country. And there are outbreaks continuing to happen all over. And we now have over 7 million known infections that have been confirmed. No real grasp on the number of folks who have been infected and have not been confirmed or tested and are asymptomatic. We have over 200,000 Americans that have died related to COVID-19. Unemployment, which at one time soared to 15%, is now hovering down around 8.5%, which is still a pretty historically high number. And according to studies, close to 50% of Americans are working from home currently. And despite, sort of many of the headlines that have really grabbed our attention over the last 6 months about employers who are focusing on remaining in a work from home setting indefinitely or for at least the long term, there has been recent polling that show not only employer but also employee interest in returning back to the office. And in fact, about 70% of employees in a recent poll showed that they would actually prefer to return back to the office as soon as possible. So while there are many employers who are thinking about staying remote and work from home for the long term, the fact is there are many employers who simply can't because their nature of business doesn't allow for it, or who are thinking about reopening their doors in an interest of doing so in a safe way and bringing employees back into the office setting for productivity reasons. And so that's kind of what we're going to dig into today. So in the intro to our return to work strategy, and as we think about how we ultimately do accomplish that and welcome employees back to work, there's one thing that's very clear so far, and that is really the need to focus on employee health, safety, and well-being as the core components of any return to work strategy. So employers have sort of, as employers, we've sort of always focused on employee health, safety, and well-being, but the dynamic in this focus has really shifted over the last couple of months to make this not just something that is a nice to have from an employer who cares, but rather a foundation for thinking about how your company actually keeps their doors open and employees in a physical office setting. And so the TouchCare Shield program that we've designed addresses 4 key elements for employers in an effort to keep people safe and ultimately productive. And those 4 key elements that we'll review here today are daily symptom monitoring and daily health checks, expert healthcare navigation for employees to help them with actually navigating any sort of COVID or non-COVID related issues, bulk testing and diagnostic testing services for infections and to prevent outbreaks, and then ultimately virtual medical support. And so as we look at TouchCare and our COVID-19 response, since March, we've really kind of been at the forefront of COVID-19 information and solutions for our employers and ultimately our members. We've developed resources and web pages for folks to find everything related to the ever-changing and developing information that becomes available related to the pandemic. We've launched programs initially for antibody testing and virtual care to address remote needs and testing shortages. And eventually, we've now pulled our learnings together over the last handful of months to create the TouchCare Shield program, which is the program designed to ultimately help employers safely reopen their doors. So as I mentioned, we're now going to explore each of the core components of the TouchCare Shield program. Our emphasis is primarily on helping our employer clients reopen safely, and TouchCare Shield has been deployed at schools and universities as well as our employers. As the ever-growing concerns around safety and welcoming folks back, the application of these tools is sort of broader and broader. So once again, the core components of daily monitoring, concierge employee support, bulk testing are what we're going to jump into next. And so as we get into daily monitoring, as more and more information is really becoming available about COVID-19 and medical and public health professionals have been really given the chance to develop strategies on how to keep people safe, one thing that has consistently been emphasized is individual status monitoring or individual health status monitoring for the risk of infection and for preventing infection and infection in others. Luckily for us, the CDC has issued pretty clear guidelines on how to prevent the risk of spread, as well as how to handle infections, whether in the workplace or just for consumers and individuals. And as such, we've sort of combined a daily symptom monitoring tool with the CDC Safe Return to Work guidelines to create a daily self-attestation tool that helps manage the risk of any infected employee before they ever even enter your building. And so as we look at the tool and kind of dig into what it means, the process is actually really quite simple. And so what happens is every day we TouchCare will send a push notification via text to each employee at your office, or that will be coming into your office at a designated time. And employees via that text link are required to complete a daily questionnaire before coming into work that day. And then based on their answers, employees are assigned red, yellow, or green status on whether or not they're ready to come into work. And proactive outreach is done via the healthcare concierge team to those who receive results that would require them to stay home to ensure that they have everything they need to effectively treat themselves or receive care. Another key component of the daily attestation tool is the reporting that is available to HR or to the site managers that can happen real time through the tool, so that the dashboards are updated, so that managers and HR folks can actually monitor as people are completing the forms, so that management is in the know of any potential absence or infections that may be occurring within your workforce. And so by doing so, employers are able to proactively manage risk without even performing a diagnostic test before employees come into work. The next component of the Return to Work TouchCare Shield program is healthcare navigation or healthcare concierge. And this is, once again, really at the core of what we do at TouchCare in our efforts to deliver a better healthcare experience. And so that can mean a variety of things related to the complexities of the healthcare system. And pre-COVID, our healthcare system was really confusing enough. And so now in the throes of the pandemic, the system is both confusing and intimidating and also super risky. And so our team of experts works one-on-one with employees and their family members to find them the care they need in the safest, most cost-effective way. And so that can mean a variety of things, as I mentioned, from answering basic benefit questions to helping people find the best providers at the best possible price, reviewing and negotiating bills, and now coordinating COVID and or other testing options and concerns. So our team really does it all, and like I said, works hand in hand, one-on-one with the member to help guide them through all of the complexities and layers inherent in the system, once again, pre-COVID and during COVID. And when COVID hit and elective procedures were shut down, for example, our team played an integral role in helping many members receive the care they needed, either in another facility or another format. When antibody testing was first made available, we were able to locate providers and ultimately pre-order tests for our members. And now, more than ever, our team is really focused on quickly finding folks the care they need, whether COVID related or not, or related to a test result or not. And then moving into the third core component here, the third cog, and really a very, very important component of any return to work strategy is ultimately managing risk through diagnostic testing. And I want to emphasize that point because, to be clear, reopening your doors for any employer is ultimately a risk, and it needs to be a calculated risk. And in order to do it effectively, we need to be able to sort of put the policies and procedures into place that enable us to best manage that risk. And the best way to do so is to implement stringent controls around daily monitoring and ensuring that there is not an active infection within your employee population. And then if you do receive a positive test, quickly addressing that employee's infection by sending them home, doing contact tracing, alerting the rest of your employees, and implementing a really sound strategy around what the next steps are for a positive infection. And so if we sort of take a look at the evolution of testing over the better part of the last 6 to 8 months, and dating back to February, testing has been really a huge focus of the government and of our public health officials. And it's largely agreed upon that more testing is a good thing for controlling the virus, both on a national and on a local level. And so the same goes for employers who are ultimately looking to reopen their doors in a safe and healthy way for their employees. So in February, the FDA announced an emergency use authorization for labs who were producing tests. And what this enabled us to do was for tests to be developed at a more rapid pace and approved in a much quicker fashion, so that we could ultimately submit results to the FDA as they go. And ultimately, what that allowed the process to do was prove efficacy after the fact based on large numbers, rather than allowing the large numbers needed to typically approve a test to slow down the process. And so viral or PCR testing was initially offered. And these were the nasal swab tests that everyone really knows about. By April, the antibody test started making a big splash and helping to detect the infection rate amongst those who were both symptomatic, previously symptomatic, or currently asymptomatic. And these tests really showed whether or not the body had produced the antibodies that actually fight the infection and ward off future infections, thus telling us whether or not you've had an infection in the past or currently. And then in May, we started to see emergency use authorizations be granted for saliva tests, which were less invasive and easier to use, and in a lot of cases didn't require doctor or medical professional oversight to actually administer. And now later in July and August, we're starting to see the EUAs, or the emergency use authorizations, for the rapid antigen tests that provide results in a quicker fashion. But what you gain in speed, you seem to give back a little bit in accuracy. So there's really levels of testing that seem to be required even with the rapid test. And so the bottom line is that there are a lot of options available, and it's an important step for an employer who is looking to test their employees to choose the most effective test and the right partner who can make it easy for them, provide reporting, and really implement in a way that's easy both for you as the employer and for your employees. And then we think about flu season starting to come down upon us, and there's a whole separate complication of whether or not it's the flu or is it COVID, and employers are going to need to quickly discern between the two. And so on-site flu shots and flu tests are going to be available and very important this flu season. And eventually we'll get to a world where the COVID-19 vaccine is hopefully approved, and this will, we predict, be something that is going to be offered through the workplace as well. So as we think about testing and really jump into testing, while there are a ton of benefits to actively testing your employee population, there's also a lot of inherent challenges. So in addition to really the FDA's involvement in speedily approving tests, the EEOC, or the Equal Employment Opportunity Commission, has issued guidelines for what employers can and cannot require of employees that are very clear and ultimately related to return to work protocols. And so the guidelines are much lengthier than this, but just as an example, employers can require viral testing and temperature checks, but can't require antibody testing. And so, as you're developing your return to work protocol, and as at TouchCare, when we've designed our return to work program, we've done so all to be in compliance with EEOC guidelines. And so it's also an important step to take a look at the different testing options and the challenges that can be inherent in the different types of tests. And so if you think about viral testing or the PCR tests, whether it's saliva or nasal, these tests tend to take a few days to get the results and can be costly. The more recent rapid antigen tests are sort of emerging as an option now, but they're also costly, and they can tend to give a little bit back in terms of accuracy. And they often require the purchase of special equipment and potentially a a lab CLIA certification. And most importantly, we haven't seen very much support from insurance companies in actually covering the cost of bulk tests as was initially expected. So in addition to the risk, employers need to understand that reopening the doors does come at a cost. And generally speaking, the cost per test doesn't get covered by insurance companies, despite how hard we've worked. And there are obviously exceptions to this. But in most cases, from what we've seen with our employer groups, this does not always get covered by the insurance companies. And so taking all that into account, I think it is worth thinking about and looking at a case study. So we're going to look at one of our clients, which has been actively deploying the SHIELD program since June. They were actually one of our first clients to go live with this, and they were deemed an essential business as a power company that controls the electricity for several small countries around the world. A company called New Fortress Energy, which ultimately decided that they needed to make the workplace more safe for their employees so that they could get back to work and quite literally keep the lights on. And by implementing a three-pronged approach, we've been able to successfully help our client keep employees safe while bringing them back into the office for over 4 months now. And the process is exactly as outlined, right? We every morning, the employee completes a daily questionnaire before showing up at the office. They have implemented the additional step of having every employee's temperature checked when they enter the office. And every week, all 200 employees take a at-home or in the office, actually, saliva test to ensure that there are no active infections. And the results speak for themselves. So since June, all 200 employees, like I said, have been back in the office working. We've accurately detected and addressed 3 employee infections that were quickly and safely addressed, quarantined, contact traced, et cetera. And through contact tracing and mask wearing, ultimately, we've ultimately been able to help them ensure zero occurrence of spread within the office. So all 3 of those infections, isolated events that we were able to quickly get under control. And so as we think about it, and really the icing on the top here is ultimately their stock has literally doubled in the past 3 months. And whether or not related to additional productivity from employees, both the CEO and the CFO of this company strongly agree and credit the testing strategy as a key piece to their success and productivity through this time. And so they couldn't be happier. Employees at the office are feeling happy and productive and safe. And so they've really, been sort of the banner company on actually executing on this plan of daily symptom and employee monitoring, healthcare concierge support for those employees who are infected or not, and ultimately bulk testing of the employee with a regular cadence. And so there are a few additional ways that we've been exploring and that we are implementing with groups that add to the efficacy of the TouchCare SHIELD program, and that we've layered in as additional or optional programs to help ultimately really improve the health and well-being of employees during this time. And those 2 programs are centered around virtual medical care offerings that allow employees to receive medical treatment in a virtual setting so they don't have to go into the office in the comfort of their own home or in the office or wherever they feel comfortable over their phone. And so the first of those programs is actually our virtual care program, which is designed to quickly provide medical support, as I mentioned, for employees and their family members in need. Really, this is virtual urgent care for employees. And so it's telemedicine. And as telemedicine visits during the pandemic have surged by more than 50%, and it's projected to continue to increase in 2021 by at least another 65. And so by offering virtual care to employees, we can quickly diagnose, treat, and prescribe for medical concerns, whether COVID-related or not, by offering employees the ability to receive medical care virtually. Whether that be through their computer or through their phone, we can be sure that they don't need to take the risk or the added risk of going into a crowded doctor's office or waiting for an appointment and potentially becoming unnecessarily infected by going into the doctor's office for something that may or may not be COVID related. The second component of this and the last component of our TouchCare Shield Return to Work strategy is offering mental health resources for employees. And so before COVID, America already was in a mental health crisis, already had a mental health crisis. Today, there are countless reports examining the impact of the pandemic, the lack of socialization, working from home, layoffs, fear, isolation, et cetera, and what that's having on our mental health. And before the pandemic, we had an access problem, and now people quite literally have a situation where they can't go out and see their therapist if they have one, let alone actually find a therapist to go see. And so through MindCare at TouchCare, we have created which we created pre-pandemic, was really designed to address that access problem of locating providers who can quickly see employees and their family members to address mental health concerns. And through MindCare, people can actually connect with therapists, psychologists even, psychiatrists even, and child therapists in all 50 states and be guaranteed an appointment within 24 hours. And you're able to choose your therapist based on their credentials, specializations, your own personal needs and preferences. And ultimately, this is designed in recognition of the fact that addressing employees' mental well-being is ultimately key to making sure that people stay productive and happy and at their job. Doing so in the pandemic is not only an option, it's really become sort of an important piece to any employer's core health and healthcare and benefits strategy. And so to sum it all up before we jump into the Q&A here, the TouchCare Shield program, like I said, was launched as a service program to enable employers to safely open their doors. And the core components of the program are the daily symptom monitoring, expert healthcare, concierge support, and bulk population testing, as well as potentially virtual care options as well. And by pulling everything together in a sort of coordinated technology-first platform experience, and then providing the overhang of that real live one-on-one customer support and real-time reporting to HR, we're able to help our employer clients safely manage their risk and ultimately ensure that the safety of their employees is the main component of reopening their doors and welcoming folks back into the office. And so with that, I think we're going to jump into some Q&A, and I believe we're going to, you can submit your questions, as Angela mentioned at the beginning, in the question box. I see we've got some coming through already, and we'll try to get through as many as possible over the next couple minutes. But if we don't get to your question, the contact information for Angela and me is going to be on the next page, and I'll flip to that. And please feel free to email us, and we will get back to you with any questions that you may have, either about the program or about best practices, et cetera. We're happy to have the discussion, and ultimately we are here to help you safely reopen your doors. So thanks again for joining us today, and I'll kick it back over to Angela for any questions.
Thanks, Rob. And yes, please submit your questions on here. It looks like a few folks already have. So the first one is, what's your recommendation on how often to test? Should it be the entire population, cadence? If you want to touch on that, Rob.
Yeah, so this is a tough one, right? I want to reemphasize the point that we hit on earlier of ultimately reopening your doors is a risk, right? And it's a calculated risk that you as an employer have to take. Ultimately, if you decide to take that risk, you then have to figure out, what is the right budget, what is the right cadence, et cetera. We can help provide best practices around that and talk about what we've done with other clients. The case study that we examined before, they're testing employees every week. Here at TouchCare, we actually test our employees every other week, and we've seen everything from monthly to employers who actually also forego the regular testing and just do it at random and hold tests on site. So there are a variety of ways to structure this. We recommend doing so with a regular cadence if at all possible within your budget. But we understand that that can be a bit of a challenge, but we think it's the safest way to actively detect and prevent any sort of infection and spread.
Thank you. We have another question here that's two-part. First, what is the type of test you use today? And are there any, are we looking at any options for rapid tests in the future?
Yes, so the test that we use today is a saliva-based viral test, so a saliva-based PCR test, which is testing for active infection within the body. And so our test, like I said, is saliva. We have an emergency use authorization with the FDA. We actually built the front end of the process for employees and the ultimate integration with our lab partners to provide results and reporting back to the HR team. And we actually control the logistics on securing the inventory and managing the tests for our clients. And so our clients really just have to let us know how many tests they want. Our test is unique in that it is not required for a doctor to actually oversee the taking of the test, which a lot are. And so it's what's called an unsupervised saliva PCR test. And for any employers who are interested, we're happy to send plenty of details on the actual test itself, the efficacy of the test, et cetera. The second part of that question was, will rapid tests become available? When will rapid tests become available? So this is something that's developing for us now. The rapid tests have started to hit the market. The government has purchased a lot of inventory for those tests to distribute back through municipalities and schools, et cetera. But we at TouchCare did actually start securing inventory on rapid tests last week. The challenge with the rapid tests are they require, as I mentioned, a special piece of machinery to actually read the tests. And while results are available within 20 minutes, you do tend to give a little bit back, as I mentioned, on the accuracy of the test. So it's important if you get a positive with the rapid test that you actually then flex that over to a viral test afterwards to ensure whether or not that person is actually infected. And so we do expect rapid tests to grow in terms of their use and popularity because of the speed that they can detect infection, but there are some complications to actually administering rapid tests around proper licensing and the purchasing of equipment that, of course, is in a bit of a shortage already. So the good news is, like I said, we secured some inventory and some process around this, and we can happily provide more information to folks around, once again, another EUA authorized test that we have available through the TouchCare Shield program.
Rob, do we have time for one more?
Yeah, absolutely.
All right. So this question is, can employees buy additional tests independent of this program?
Yeah, employees can. This is actually something that we just recently are introducing to our TouchCare clients. And in the short future, we'll be offering to really anybody. But yes, employees who are interested in purchasing tests for themselves or for their family members outside of what their employer is providing will ultimately also have the ability to purchase tests through the TouchCare Shield program on their own. And the process is largely the same. You fill out an online form. you get your address and we mail you the test and tell you where to send it once you take it. And you go through the exact same process via the online form where you fill in your demographic information and the barcode information of your test before you send it. And then ultimately, when you get your results, we'll send you the email. So that's a long way of me saying yes.
All right. Well, it looks like you answered the other questions. If anyone does have anything else, we'll give you another minute to put on here. If not, we thank everyone so much for your time today. We hope that you were able to get a lot out of this webinar. Oh, it looks like there are other questions coming in. Hang on, let me just see here. Can I get the daily screening portion of the app? Oh, just get. So yes, they're asking, can they just get the screening portion, not the rest of TouchCare Shield?
Yeah, so we have employers who take the screening portion and the healthcare concierge kind of come together as a bundle, and then you can add on the ordering of bulk testing and reporting, as well as the virtual care options that we talked about. So yes, the core components are that daily monitoring plus the healthcare concierge services, and then any employer who's interested in also doing testing, we fulfill those orders, and then we can also add on the virtual care options as sort of piecemeal add-ons.
All right, one last question is, does this cost something, or is it covered with our current relationship with TouchCare?
No, this is an additional cost. If you're a current customer of TouchCare, there are pieces to this that would make it very easy to transition into, but it does come at an additional cost. The daily monitoring program comes at an additional cost, and then obviously the tests have a cost associated with them.
Okay, great. Well, with that, we'll wrap it up, give everyone 21 minutes back in their day, because I know everyone's super busy. But again, thank you so much for joining us. You have our contact information here. Please do not hesitate to reach out, and we're happy to give you additional information and pricing. Thanks again. Have a great day.
Thanks, everyone.